Heart disease is the #1 cause of death in the United States. The National Heart, Lung, and Blood Institute, the NHLBI, which provides leadership for a national program in disease of the heart, blood vessels, lung, and blood resources, and sleep disorders, funded this project to help African Americans prevent heart disease. This web-based training session, being conducted by the project team at Morehouse School of Medicine, will help community health workers, CHWs, like you learn the risk factors for heart disease so that you can help to educate other community health workers and clients. I am also encouraging you to participate with other community health workers in the online discussion forums that will be available in the virtual classroom as well. There are a total of 10 web-based sessions that you will cover during this training. If you are also participating in the Learning Circle discussions, these sessions will be taught in more detail in the classroom. The sessions are Knowledge is Power, Know Your Risk of Heart Disease, Act in Time to Heart Attack Signs, Get Energized, Say Yes to Physical Activity, Help Your Heart, Control Your High Blood Pressure, Be Heart Smart, Keep Your Cholesterol in Check, Embrace Your Health, Aim for a Healthy Weight, Protect Your Heart, Take Good Care of Your Diabetes for Life, Make Heart Healthy Eating an Everyday Family Reunion, Eat in a heart-healthy way, even when time or money is tight, Take control of your health, Enjoy living smoke-free. There are accompanying handouts and picture cards for each session to be used when you are teaching these sessions to other community health workers or clients. Handouts are available at the end of each chapter of your manual. Electronic copies are available by clicking your mouse on each handout title. Hello, and welcome to the Peer-to-Peer Training and Community Health Workers to Improve Heart Health Project. We will continue with Session 4, Help Your Heart, Control Your High Blood Pressure. By the end of this session, you should know what blood pressure is. That it is best to have a blood pressure below 120/80 millimeters of mercury. That blood pressure between 120/80 and 139/80 is pre-hypertension. That a blood pressure of 140/90 is hypertension. What a stroke is and what the warning signs are. That eating less salt and sodium can lower the risk of developing high blood pressure, and that you can take steps to lower the amount of salt and sodium in your diet. When you are teaching this session, you will be referring to 10 handouts located at the end of Session 4 in your manual. Know the stroke signs, Act Quickly on page 108, My Healthy Heart Wallet card on page 109, Take Steps, Healthy Habits to Lower High Blood Pressure on page 110, Read the Food Label for Sodium on page 111, Darnell's Food Choices on page 112 through 114, Sodium in Foods on page 115, Keep Your Heart in Mind, Eat Less Salt and Sodium on page 116 and page 117, Tips for Taking Medicine for High Blood Pressure on page 118, Use Herbs and Spices instead of Salt on page 119, Soul Food Makeover, Vegetable Stew Recipe on page 120, and finally you will work along with other community health workers to make a list of places where persons can get the blood pressure checked. Electronic copies of these handouts are available by clicking your mouse on each handout title in the sidebar located on this page. Let us begin with the facts about blood pressure and stroke. More than 1 in 3 people in the U.S. have high blood pressure, and nearly 1/3 of these people do not know. 59 million Americans have pre-hypertension. 4 in 10 African Americans have high blood pressure. African Americans are more likely to have high blood pressure than any other racial or ethnic group in this country. High blood pressure tends to develop at an earlier age and be more severe in African Americans as compared to whites. African American women are 3 times more likely to die from heart disease or stroke by age 60 as compared to white women. More than 19,000 African Americans die of stroke every year. Blood pressure is the force of blood against the walls of your arteries. Pictured here in red on picture card 4.1. Arteries are responsible for carrying oxygenated blood and nutrients to the cells, and this pressure is needed to deliver the blood and nutrients throughout your body. Pictured here on page 4.2, you will see that blood pressure is recorded as two numbers. The systolic pressure, which is the top number, this is when the heart contracts or tightens, over the diastolic pressure, which is the bottom number. That is when the heart relaxes. The bar or line written between the two numbers is verbally expressed or said as over. So it is read as 120 over 80. Looking at the chart below, you will see that a normal blood pressure is less than 120 over 80. Blood pressure between 120 over 80 and 139 over 89 is pre-hypertension. Pre-hypertension means that you don't have high blood pressure yet, but you are more likely to develop it in the future if you don't make changes to your health habits. High blood pressure is when your blood pressure is 149 over 90 or greater. Your heart has to pump much harder than it should to get blood to all parts of your body. If you have a blood pressure reading that is 140 over 90 or greater, you need to consult your doctor or nurse immediately. You may have heard high blood pressure referred to as the silent killer. This is because very often blood pressure has little to no symptoms. High blood pressure is also a major risk factor for stroke. Other risk factors for stroke include heart disease, smoking, diabetes, obesity, and high blood cholesterol. Referring to picture card 4.4, next we will discuss strokes. A stroke is also called a brain attack. A stroke happens when blood suddenly stops going to the brain, and as a result, brain cells die. A stroke is very serious and can lead to disability and death. The warning signs of a stroke happen suddenly. An individual may have one or more warning signs, which could include numbness of the face, arm, or leg, especially one side of the body, confusion, trouble talking, and difficulty understanding others, trouble seeing in one or both eyes, trouble walking, dizziness, and loss of balance or coordination, and also severe headaches. There are strokes that are called mini strokes. Many strokes have the same symptoms as a stroke, but usually do not take as long or cause brain damage. They may last a few seconds or an entire day and then just go away. These signs should not be ignored, and someone should call 911 right away if they think they are experiencing a mini stroke. Everyone should check their blood pressure at the very least once a year to find out if they are suffering from high blood pressure or pre-hypertension. Individuals already diagnosed with high blood pressure should check their pressure much more often. Your client can use the handout My Healthy Heart Wallet card on page 109 to keep track of their numbers each time they have their blood pressure checked. How much salt or sodium do we really need? Most people in the U.S. eat about 8 to 12 times, which is about 4,000 to 6,000 milligrams, more sodium than the body needs on a daily basis. The body only needs about 500 milligrams of sodium per day. That equals to about 1/4 teaspoon of salt. If you are consuming more than that, you should lower the amount of sodium you consume to about 2,300 milligrams or 1 teaspoon of salt per day. If you have high blood pressure, try to decrease your sodium intake to about 1,500 milligrams or 2/3 teaspoon of salt daily. Now let us take a look at some foods that are high in sodium. Most of the sodium that we eat comes from packaged foods, foods from restaurants, fast foods, and the additional salt added during cooking or at the table. Here are some examples of packaged foods on picture card 4.6. Regular canned soups and vegetables, frozen dinners, macaroni and cheese, salty chips, regular lunch meats such as bologna, meats high in sodium, hot dogs, and bacon, canned fish and meats such as salmon, tuna, sardines, and Vienna sausages. Picture card 4.7 shows an example of the food label found on the back of packaged food. This is one of the best tools we can have for choosing foods for a healthy diet. The food label lists the serving size, number of servings, calories, sodium, and carbohydrates, saturated fat, trans fat, and cholesterol in one serving of food. By using the food label, a person can choose foods that are lower in salt and sodium to help prevent or lower high blood pressure. Look over the Read the Food Label for Sodium handout on page 111 and be sure to identify the components of the food label that we have discussed. You can then use handouts on page 112 and page 114 to make comparisons of food labels. It can be hard to shake the sodium and salt habit. Your client might feel like the food has no flavor. You can suggest using herbs and spices to add flavor to foods. You might hear, "My family would not like it," and may get upset. You can just cut back on the salt slowly so that your family can get used to the taste. Finally, we know that adding salt is a habit that is hard to break, so choose brands that are lower in salt and take the salt shaker off the table. Finally, take it easy on the alcohol. Drinking too much alcohol can raise your blood pressure, harm your liver, brain, and heart, and can make it hard to control your weight. Men should have no more than 2 alcoholic drinks per day, and women should have no more than 1. Pregnant women should not drink any alcohol. Take a look at the list of the number of calories in a single alcoholic beverage. If you have high blood pressure, making the lifestyle changes we just discussed may not always be enough. There are medications available to lower your blood pressure. They work in different ways. For those who are on medication, let's go over some steps to help blood pressure medicines work better. Ask your doctor the name of your medicine and how to take it. Take your medicine the way your doctor tells you. Tell your doctor the names of all other medicines, home remedies, herbs, and supplements you take. Tell your doctor if the medicine makes you feel strange or sick. Refill your prescription before you run out of your medicine. Have your blood pressure checked to see if the medicine is working for you. And finally, keep taking the medicine as your doctor tells you, even if your blood pressure is okay. Now that you have completed this session, do you have any questions? Is there any information that is unclear to you or difficult to understand? What information covered in this session do you think community members may have difficulty understanding? Are there any issues particular to women that should be highlighted in this session? What information covered in this session do you think may be a little challenging for you to present? Why? You will have an opportunity to share your responses with other community health workers in your Learning Circle discussion and on the online discussion forums.